to say 6:01 and it just flipped on over to 6:01. So if we're okay with everyone, I think it's time for us to go ahead and get started. I want to start off with a few technical housekeeping issues. The first one is we sometimes get some questions that come into the Q&A and into the chat that say that they can't hear. And we find that often that is because you're using a headphones or there's a headphone plugged in somewhere and there's something that's messed up with the WebEx when you sign in that way. But if you can't hear, there is a dial-in number for audio. And we also want to let you know that if you get bumped from the WebEx meeting, please try and log out and log back in. Another thing that's not on here is that make sure when you're submitting questions, and we encourage your Q&A, that you put that in the Q&A and not in the chat section, because that's very helpful for us, function for us, and submit it to everyone, not just the host, so people can see your questions. But also make sure you're not putting anything that's too specific. It should be a general question. Today we're going over claims, so let's try and keep it to today's webinars. I already saw a question in the mailbox that asked if we were going to email this presentation out to everybody. All the presentations are available on the DCH website, and I'll give you that website in a minute. All the presentations are available. All the recordings are available, word for word. The whole recording is available for both days that we do the trainings, are available on the website as well. Joe, do you mind? Oh, thank you. You're so good at anticipating when I move forward. One more slide for me. So we always start our presentations with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality care through effective planning, purchase, and oversight. Purchasing. I need to get the mission statement right. So today we're going to go over some status updates and timelines. We're going to give you all of the DCH communication resources that I told you we would do before. We're also, TELUS is going to give us a really good EVV claims portal demo, and then we'll do some Q&A at the end. Please do try and keep your Q&A specific to the topic for tonight. I'll go over how you can submit general email questions in just a second. So, status updates. Where are we with EVV? The EVV implementation is on schedule. We are doing extensive third-party EVV vendor outreach, and we've begun the onboarding process, and that has included the fiscal intermediaries for individuals that are participant-directed or self-directed. You will be hearing more about additional trainings and town halls very, very soon. So I did want to go over our timeline because I know we've been saying some different, not different things, but I wanted to just put it in a different kind of framework for folks. So we've been doing, and I've heard Joe say this several times, and he's very right, we've been doing training for a while now. We've done multiple town halls. We've done outreach to individual providers and individual members. You can, again, go on the website and see all of the trainings that we've done. So it's interesting to say provider training is opening it when we've been doing the trainings all along. But in March, what we're going to be doing is specific trainings associated with using the application. As of April 1st, 2021, the system will be fully ready for use. We're going to do that initial training. The initial first phase of training will be complete, and all the providers will have an opportunity to utilize that training in March. And members and anybody else we're trying to reach out to will have be afforded that training. And we're going to also do ongoing support for anybody who starts using the system April 1st, 2021. We will have a small group of providers that we intensively work with in April, just to make sure that there's no glitches or bugs that we see and that the rollout can be mass rolled out as quickly as possible and as efficiently as possible. In May, we're going to start a really big recruitment campaign to get as many folks on board as we can and to get to that 100% compliance. So May is going to be a really big recruitment campaign month for us. And we'll also be using that to look at system refinement. We don't anticipate any major issues with the system of any kind, but there may be some cosmetic things or otherwise that need to be updated in the system. So that May, June time is going to give us enough time to make those corrections. Effective July 1st, 2021, all claims processing for PSS and CLS will be mandatory through the EVV system. So we're going to need that recruitment campaign to get on board in May to make sure that when we get to July 1st, that everybody doesn't have a disruption in payment for the services they render. I think that's it for that slide. So communication resources. Just today, I had a couple of people ask me in the EVV mailbox, where is all the information for EVV? And I gave them this top website, medicaid.georgia.gov, this backslash of Georgia/electronic/visit verification. But let me tell you an easier way to do it. Just go on Google or Bing, or I don't know if Ask Jeeves is still a thing, but whatever search engine you use, and put DCH EVV GA or just DCH EVV. The first thing that will come up is our webpage. If you have, and that's that top button, all of our information is there. There's links on the left specific to providers, specific to members. There's a link that gives you a schedule of events. So you can register for this meeting or any of our future meetings right there on the website. All of our PowerPoints are there. Our flyers are there. Our member and provider readiness surveys, frequently asked questions, and quick reference guides are all on that website. Everything is transparent. We are putting everything out for public use and knowledge. Additionally, if you have questions, you can submit your specific questions to evv.medicaid@dch.ga.gov. Now, I have to do a confession. I have not looked at the mailbox this week until a few minutes ago. I'm usually the one who updates that message and have been for a couple of years now, probably answered 1,000 questions at this point. But I just got behind this week. So I've probably got 6 or 7 questions out there yet to answer. And I will get to them and all the questions in the mailbox from today or tomorrow by the end of the weekend. So please do feel free to use that email box to ask your specific questions. Next slide. Okay, I'm going to turn it over to Joe Schnurr now, who is the Chief Customer Officer for NetSmart at TELUS, and he'll take it from here. Thanks, Joe.
Awesome. Thanks, Brian, and good evening, everybody. Thank you for being with us tonight. So we've had a kind of a progression of demos, and like Brian said, in some perspectives, they're training. We're showing you how the system works. And then, like Brian said, next month, as we get closer to the launch, we're going to get much more specific. But tonight, the goal is to give you a good overview of how you will submit claims through the TELUS portal. Okay. Hold on. My computer just locked up for a minute.
While you're locked up, I'm going to answer another question that's in the Q&A. It's a specific question that says that it looks like that there was a provider that was going to have a use a third-party vendor, and now they've decided that they would just like to utilize the TELUS system. That's perfectly fine to do. There is no problem with you going ahead and using the TELUS system. If you have been working with TELUS on integration, you're just going to want to utilize that email box to just let them know that you're not going to move forward with that, and just continue your training with the fact that you're going to start using the TELUS system.
Perfect.
All right, Joe. Sorry, didn't mean to break in on your Q&A.
No, thanks for the filler. I appreciate it. Okay, so just in review, we have discussed on previous town halls that there are two main components to the solution: the mobile application and the administrative portal. And as Brian had mentioned, if you have missed any of those presentations, we do highly encourage you to go back and listen to those recordings so that you can understand how those different systems work. What we discussed is that you can create a visit in either the admin portal or the mobile app. You complete the visits, meaning you clock in and you clock out, or you start and finish the visit on the mobile app. And then tonight, what we're going to be talking about is how do you bill for those services, otherwise known as submit my claims. Okay, so now I am going to flip over to the portal itself and show you. Okay, so I am logged in to the TELUS portal, and don't worry about how do I get here or how do I get logged in. We will cover that in future town halls. In fact, we're going to have a very specific town hall on how do I get registered and receive my credentials. And we'll go over all the details on how you do that. So you're logged in to your administrative portal, and this is for administrators. So this is not being used by the caregivers. So the administrators are the ones that are doing the billing or the fiscal agents. And you can see my menu bar down the left-hand side. And again, in the last town hall, we went through many of these components. We went through what this dashboard does. We went through this messaging box. We went through how to schedule visits, how to review all your previous history of visits. We went through how to load your caregivers, how to view your recipients' information, and even some reports. So I will not go back over those again. But again, all that is on the website. Tonight, I'm going to go through three specific areas: the prior authorizations, then I'm going to go to the work list, and then I'm going to go to the claims review. So I'm going to show you how each of these work. Okay, so I'm going to go to the prior authorizations first. And many of you are probably aware that we are going to get a feed from DCH, and when you log into your portal for the first time, all your authorizations are going to be here already. So we get those feeds on a daily basis, so any updates to authorizations are loaded every day. So again, you will not have to load these yourself, and they're going to be loaded in here for you. So you can see, now again, this is my demo system, so it's not Georgia specific, but you can get an idea how the functionality works. So I have just a few kind of made up authorizations in here so you can get an idea. So you can see that I have my recipient's name, the Medicaid ID, the member ID, what procedure code, what the effective dates are for the authorizations, what the number is. If we're getting a status such as maybe this authorization is no longer valid, we would have invalid or voided or whatever that status might be, who the payer is, if there's any specific programs, how many total units are on the authorization, and then how many units have been used, and then the percent remaining for that authorization. Now, if you click on any one, you can see as I hover my mouse over the lines, you can see kind of the color change a little bit. If I click on any one of these, what it does is it opens up that authorization and gives me more detail. And if I click on it again, it will just shrink it back up. So you can see now that I have a wider view. A lot of the information is in the summary, but there's just more information on here. So again, some of these areas are not filled in because, again, this is not a true authorization. But all the information that is sent in the feed will all be represented on the screen. So that's pretty much all there is to the authorizations. That's where they are stored, and that you can view them, and updates are done, like I said, automatically. You don't have to do anything in order for an update to come over. And of course, up here at the top, there's different search criteria. So if you just want to search by, if you have maybe hundreds of different recipients, you can obviously, you can see when I click in the box, it lists them out. I can type in a name. I can scroll down the bar. So very easy to use to find a specific recipient. You can do it by procedure code or modifier. If you know the specific authorization, you can do it by that as well. And then you would just hit search, and it would give you that specific information to meet your search criteria. Okay, so let us know in the chat if you have any questions around the authorizations. Next, I'm going to go over to the work list. When I do, it just tells me that I'm leaving this page. I hit OK. Now, it's going to ask me to select my payer. And the reason we do that is because the system does allow multiple payers. Of course, we're focused on Georgia DCH, but there could come a time when providers use the system for more than that, as we incorporate maybe the managed care organizations or other potential payers down the road. So for now, I'm just going to select Aetna, Florida, because I don't have Georgia in my demo system. And you can see that it did pull a bunch of visits that I have. So the work list is basically visits that are coming into your work queue. And what you're doing is, think of this as, some people use the term visit maintenance. So visits are constantly coming in throughout the day from the caregivers. They're in the field completing visits on the mobile application, and then the visits are coming in. They're always stored in the visit tab, and I can go back and look at any history, but then the ones that I need to bill for come into my work queue. And then the idea is I bill for all these and they go off my work queue. So a biller wants to probably keep a pretty clean work queue because anything on here hasn't been billed yet. Once you bill it, then it goes over to the claim review tab. So I'll show you that next. So again, these are visits that have not yet been billed. Now, you'll notice again, some header rows here. The recipient's last name, first name, Medicaid ID, visit ID. This is a really important one, status. So there are a couple different statuses. The main two statuses are either matched or unmatched. You can see this one, actually most of these in here are unmatched. What does that mean? That means that this visit came in, it went through our business rules that we have worked with DCH to set up and are there for your behalf because these are rules that are going to flag problems with this visit so that you don't bill something that will just get denied anyhow because it doesn't meet a rule. So the idea of the system is that we help you catch things that are wrong with the visit so that you can correct them and accurately bill for your claims. So you're going to come in here and clean up any of the reasons that things are unmatched. And I'll go through that with you in a second. Just continuing along the top, procedure codes, diagnosis codes, service dates, authorization number, and you can see that some of these are blank. What that means is I don't have an authorization in the system that matches this visit, which of course is going to be a problem because we need to have that authorization in order to be able to bill for that visit. You can see the payer's name, you can see both a calculated amount and a billable amount. And I'll explain the differences between those. Okay, so the only just to cover, paid amount is on here, but remember I said these are visits that haven't been billed yet. There is exceptions if it was billed and then it was rejected or it was partially paid and you need to file an additional payment, then it gets pushed back to this work list so you can rework that claim. And in that case, there could be a payment amount. But as you can see, all of these have not been billed, so there is 0 for the paid amount because it hasn't been billed yet. Okay, so just like on the authorization tab, if I click on any one of these, it will expand. And now there's a whole bunch of information here that it gives me on this visit. And again, this is coming from both the information that we have from the feeds, such as the recipient information here, the IDs and the payers, all of that is under the recipient tab that we reviewed last time. And that is coming from the feed that we're getting from DCH. So we're pulling that information into this tab because we know that you did a visit for, in this case, Dixie Hyde is our recipient. You can also see that the verification type used for this visit for both the start and the end was GPS. There might be cases where IVR is used, and when it is, this will say IVR. You can also see that it has the scheduled time, the actual time, and the billable time. So let me explain the difference there. So scheduled is just like it sounds. It's what time the visit was scheduled for. The actual time is the time that the caregiver actually recorded a clock in on the mobile device. So you can see there is a difference here. It was scheduled for a 12 o'clock visit, but the caregiver actually clocked in at 9:23. So they were early for their visit. That's not a problem. That happens. And so you can see the difference. Billable time is if they made a mistake. Let's say that the caregiver actually showed up at 9 o'clock for the visit, or even 8:45, but they forgot to clock in on their mobile phone. And then they remembered at 9:23. Well, what they're going to do is they're going to call the office, the administrator, and say, I made a mistake. I didn't clock in when I first got here. I actually arrived at 9 a.m. And then an administrator is going to need to come in here and make the adjustment. You can see there's a little pencil right here. And I can make an adjustment and I can put in the billable time. And this would, yeah, this is back in April, so I'm not going to do that here. But this will actually default to today's date. You fill in the time, you put in a reason code for whatever reason it was, billable time, say increased or decreased. You put a note, caregiver forgot to clock in on time. and then you would hit apply. When you fill it all in, the little apply button will illuminate and you can fill that in. So that would be an example where you would have 3 different times. You'd have a scheduled time, an actual time, that in this case it was incorrect, and then you would affix it through the billable time. And so you'd be able to see all of that information will be recorded here. So that goes to the calculated unit and amount. So we're going to calculate, the system is going to calculate the number of units based on the clock in and the clock out time, and based on the service code, whether that's a 15-minute code or it's an hour-long code, the system's going to know that based on the authorization and the code that was used, and we will calculate the number of units, we will pull the rate, and we will calculate the amount. However, if these actual times are not correct and you update with the billable time, then we need to adjust the billable units and the billable amount, which is done here. So that gives you a few ideas of why there's all these pencils on here. You can see that some things are editable and other things you are not allowed to change. And those are all the rules that we're working out with DCH right now as to which data is coming from the state and is not allowed to be changed versus which data points are allowed to be edited. Now, if I go all the way down to the bottom, there's this area called edits and errors, and it will tell me why this visit was unmatched. And you can see there's a couple here. The prior authorization was not found. And if you remember, here's the system assigned authorization number, and that is blank. Now, in reality, what happened is I don't have an authorization for this visit. That shouldn't happen too often. You should be scheduling visits that have an authorization. But again, in my demo, I don't have authorizations for everything. So this comes up more often than not in my demo system. Now, in the DCH system, you're actually not going to be able to bill unless that authorization is there. So we're going to need to find that authorization before you can bill. There are other errors on here. Some of these have actually already been corrected earlier, and we will actually make notes. We'll tell you who modified it. So you can see Eric was in here earlier, and he fixed some of these things, these errors, and it recorded that Eric came in here and what Eric did. So we keep an audit log of every change that is being made in the system. So again, when we go through the detailed training, we're going to go through all these edits and errors, so you don't need to worry about all those now. We're going to go through that in more detail, but I wanted to at least give you an idea of an unmatched visit, where you go to find the reasons, and then how do I solve for those edits and errors. So hopefully that gives you a good explanation of your work list. Now, if these are matched, then once they're all matched, then you can release them. Let me see if I have any matched in here. I have one matched. So you can see this one is status matched. And if I highlight this visit, you can see that I can have either rematch the visit, that means rerun it through the rules. I can actually export it into like an Excel spreadsheet if I want all my information, or I can release it for payment. So if I want to release this for payment, I click the release button, and it says the selected matched visits are being submitted for processing. And then it said there's no information here anymore because it just released that visit and it cleared my queue. So now I have no queue left for matched visits. So again, I'll just get rid of the matched. I'll hit search again, and then it will bring up my entire list. So let's say you have a bunch of batch. You've went in here, you've done all of your visit maintenance, you've cleared all the edits and errors, everything's now matched. With one click, you can highlight all the rows and you can hit release and submit all of those visits. So very quick once all your visits are in a match state. Okay, so let's say now that you've done that, and you've worked through your errors, you've cleaned up your visits, you've released a whole bunch. Now let's go over to the claims review, because I want to get an update on what's going on with all my claims that I submitted. So again, I select a payer. You can see that I have multiple search criteria. I can look at different statuses. I can search by authorization numbers. I can put actual start and end periods if I just want to look for like the last week. If I want to look at certain recipients of claims that I have waiting, all these are different search criteria that we give you, so you can refine your search. Okay, so just like the other views, you have the headers. At this point, I probably don't need to go over it again. They're very similar. We try to make it easy to go from screen to screen and make the layouts very similar. Again, if I click on any one of these, of course, it will expand and it will give me all the detail. Now you'll notice that all the pencils are gone. Well, that's because this is a submitted claim and I can no longer make changes to a submitted claim. However, you can see all the changes that I did make in order to get this visit ready to be submitted. So we do pull over all of those, that audit log for you there. So again, this is one that you've worked in your work list, and now it is in submitted status. If you want to print or export any of these, you can do that. So some people may want to print out a bunch of claims for the week, for the month, and you can just search by whatever period that might be. You can highlight all the rows and you can hit export and it will export it in a spreadsheet for you and give you all that information. So you can see, again, the different statuses here. I've got some claims that I've submitted. I've got some that I released. I've got some that are in accepted. Because this is a demo, I don't have any that are paid, but you would have paid in here or denied. All the different statuses that you would accept as a claim makes its way through the adjudication process. So again, we are getting feeds from the state so that we can continue to update these statuses. Again, we will go over many more details in the training to explain all the statuses and how long it takes to move from one status to another. We'll get into all that detail in the training. So I think, and Brian, let me know if you agree, do you think that hit our goal for tonight of giving a good overview of how the claims work?
Absolutely. Thanks, Joe.
Great. I will go back to PowerPoint. And I know we have 2 more updates to share. You want me to cover this slide, Brian?
Yes, please.
Okay. So we know that many of you are already doing EVV, and that is great. And what this slide shows is all the third-party vendors. We call them third parties. You call them your EVV vendor. And these are all the vendors that we are in the process of integrating with so that the data will flow from your system into the TELUS system. You won't have to upload or do any of that. We're creating an interface with your system so that that data flows over. So first, if you are using another system, you should see the name on the list. If you don't see the name on the list, then please ask your vendor to reach out to us immediately. And here's the email down the bottom: integrations@4 fortellus.com. And that is on the website as well. And I'll actually go to the website and show you where you can find that. But if you don't see your vendor, please ask them to reach out to us immediately. This is the list that we got when we sent out the survey. And you all gave us the list of the vendors that you are using. Now, you will notice that some are in black font and some are in blue font. What's the difference? So the ones that are in blue font are already what we call contracted. So we have the first step for the vendor is to fill out some paperwork and agree that they're going to be able to meet all the requirements for DCH. And so that is step one. So you can see, again, look at your vendor. If they're in blue, that means they're already past the first step. If they are still listed in black, maybe you can give them a nudge and ask them to get the paperwork started so they can continue to move through the process. So hopefully, again, you see your vendor here. If you don't, please ask them to reach out to us immediately. As you can see, it's a large list. There's 30 plus different vendors. So we've got a lot of work to do to integrate with all of these. Now, the good news is many of these vendors we have worked with in other states. So it's basically just making some tweaks based on the requirements specific in Georgia. Okay, Brian, do you want to take this slide?
Yeah, sure. I'll take it.
Okay.
So we just did want to inform you guys of upcoming town halls. We will be doing a lot of training prep in next month's town hall meeting, which is 3-4 and 3-5. Looking forward to that 4-1. Everybody can use the system date. We may switch April and May's. We're still thinking about whether or not it makes sense to do a registration town hall as part of our outreach campaign that we talked about earlier, or an enrollment campaign, recruitment campaign. I think we'll probably move registration up to April, though, just so we can make sure that we get as many people registered to use the system as quickly as possible. So that's what I think we'll see those topics flip between May and April, but we haven't landed there yet. The rest of the dates we're going to leave open for whatever you guys need, really. Open Q&A, whatever topics we're seeing that you all think we need to focus on, whether that be through the chat or through emails or things we're hearing from the associations or members. Wherever it is, we'll fill in the blanks there. Okay, I think that leads us to our Q&A section. Tell me if I'm right, Joe, or if there's another slide that has something else. I'm right. So I do want to remind you that this is the EVV question that goes right to the mailbox. And I promise you I will be caught up with all questions answered by the weekend if I haven't answered your question already. And I do encourage people to send in questions to the mailbox. Some of the best suggestions and questions we get are from that mailbox. So let's go through as many of the questions as we can right now. The first question that we haven't answered within chat is, how are members' renewals completed? Will the case manager still have to sign for the DMA6? This system does not have anything or connection to the annual renewal of level of care process. So your level of care is outside of EVV, and it will continue as it does now. The next question I got is about access care. Access care, and is it on the list? And while I was going through them, I looked, and it is on the list. So access care is on the list. Can we print an exception report from the work list section to review hard copy? Joe, I believe you said that could be done, correct?
Just getting off mute. Can you read the question for me?
Yeah, it's, can we print an exception report? Oh, Lord, it just went away on me. Can we print an exception report from the work list section to review hard copy?
Yeah, so you could, I think this answers the question. You could search all of your, they're calling it exceptions, so maybe what they mean is the unmatched visits. You could search by that and then highlight them all and export those.
I'm sure that's what they're saying. Yeah. The next, so thank you, Joe.
Sure.
The next question is, I also assume this is a demo, but when will provider training be? So there's a slide here that tells you that. So we're really going to start that intensive training next month. This question is a couple of times on here, which is, will participant-directed individuals utilize TELUS or the fiscal intermediary? We are working with the fiscal intermediaries right now to treat them as a third-party system. So we're in that process. We had a meeting with one today. We got another one with a different fiscal intermediary tomorrow. And our hope is that they will be treated as a third party, and that will not mean that you don't have any disruption to the way your services are done now. The next question is about changing the administrative settings. If you're in HR, I'm going to take that one offline and maybe email that one back to you. So we can capture that for you. The next question is there a limit to the number of times we can do an administrative override? No, there's not, but that's certainly something we'll be monitoring. So I've probably told this story before. I worked at record stores when I was a kid. For those of you who don't know what that is, there used to be these circular things you listen to music on called records. And I worked in a record store the whole time I was pretty much all through college and then a little bit more. And we had a clock in. We had a clock. We had a time clock. I was terrible about clocking in and clocking out. And I got written up twice in 5 years for not clocking in and clocking out. So if we see that there is an agency or a provider or a specific worker that is really, really, really not clocking in and clocking out, we're going to have some quality assurance questions that are associated with that. Okay, answer that one. Is the turnaround time for payment to providers going to be the same? Yes. So nothing changes about the MMIS billing time, or I know we're one of the quickest states in the nation, if not the quickest state in the nation in paying claims. So none of that will be changing out of MMIS. Can we adjust denied claims? Well, that's a great question. So what Joe was showing you is before the claims get sent in, the exceptions will have to be resolved. So we're going to be knowing that the claims are clean when they go over to MMIS. For alternate EVV providers, will file format specs be published? So you need, absolutely. So if you go to the EVV website and go to that third party tab, all the information is on there, and you can ask questions to TELUS from that email box that was on there, but specifications are on that site. So in July, we will no longer be able to submit claims to GAMUS. That is correct. You are correct. All claims for payment as of July will have to go through EVV. The next question is, why is structured family caregiving not part of the EVV program? And that is because it's not federally mandated. So right now we are sticking to what is federally mandated. And then in the future, who knows? We may incorporate structured family caregiving. There are states that have incorporated non-emergency transportation, durable medical equipment. There are states that have introduced EVV for almost every service. Are we able to register now? We would prefer you wait to register until we do our registration events. Will staff be able to complete DCH mandated task sheets on the EVV system? So tasks task notation are part of the EVV system. That is correct. No. Will we need to submit our DMA 80s into the web portal? No. I mean, for EVV, does not have anything to do with your DMA 80s. It looks like this system is taking place the GAMAs for billing for CCSP Source Now for personal support services and community living supports. It will pass the claims to MMIS. That is correct. What is the cost? There is no cost to the use of the telesystem. Provider companies will, the next question is what date do provider companies need to have EVV implemented by? Again, that timeline is the timeline that we're going with. It's part of this presentation. Mandated claims will be 7/1. So if you're not up and fully functional on the EVV system by that time, your claims will not pay. Yes, we will follow up with the web page that is associated with the third-party billing. Now, I think there were a few questions also in chat. So let me go to chat. I answered the chat questions already in the other one, so that's kind of awesome. Again, I think I went through those questions pretty quickly, but they will be on the recording. So if you need to go back and listen to the recording, you will have the questions and answers. And I encourage you to go and submit if you're like me, you'll think of a question an hour from now or tomorrow, and you will want to submit it. That's what you use the email box for. 99% of the time, you're just talking to me, and I'm emailing you back. Sometimes it might be Lee Clovis or one of our other waiver specialists, but 99% of the time, it's me. So just feel free to go ahead and send it to us, and we will get that right back to you. One last question before we go. Somebody said, I thought you said a different code. Is this for CLS only? I thought you mentioned another code. It's for CLS and PSS. PSS is CLS in the other waivers. So they're very similar services that are in different waivers. So I know that's confusing for folks, but they are really the same service. So now in comp, we are only looking at community living services. Okay, so I think we're at the end of our questions. If not, feel free to go ahead and send those questions in the email box. We really appreciate everyone's participation tonight. And thank you very much for attending our town hall meeting. Have a good night.
Thank you, everybody.